appointment today for, let's see, you have it for 11:15, so you're here a little bit early. Thank you so much for that. That's good. Since this is your first time, I want to establish care, so I'll be asking you a series of questions, okay? This will take a little longer than usual, but I think you're going to like it, and thank you for your patience, okay? So can I have your full name and date of birth? Okay. Lester McGillen. Okay, great. And it is 8/24/1979. Okay, that's great. And can I have your full address and phone number? Okay. And your apartment number? Okay, good. Awesome, and your phone. Okay, 555. Awesome, that matches up with our records, so it is in fact you that's here. That's good that we have your identity all right. And I'm just going to ask if you have medical history. Of course, everyone has a medical history, but yours in particular, I have a lot of questions for you, so just bear with me, okay? All right. So do you have a history of asthma? No asthma, okay. Bleeding disorder? Are you bleeding now? And anywhere? Okay, good. Wasting disease? No, okay, that's really good. And do you have high blood pressure? Okay. All right, only when you go to the doctor. That's actually very common. So if you get your blood pressure checked when you're at home and it's normal on a consistent basis, usually that's nothing to be worried about, but we're going to go ahead and check that for you, okay? All right. Headaches and migraines? Only during the election season. That's understandable. Okay. And what do you do to treat your headaches and migraines? That's good. Very good. I think meditation is a lot stronger than what the medical field likes to admit, so I'm very happy that you're into that. COPD or diabetes? No. Fainting? You sure? Okay. GI problems? No? Okay. So what about any history of heart disease with you and your family? Anyone having heart disease? That's really good. So you have a strong heart. Do you have any muscular or skeletal problems? Your skeleton's doing okay? Okay. All right, that's great. When's the last time you had an x-ray? It's been a while. Okay, I think I'm going to set you up for an x-ray after this appointment. Okay. You have really good insurance, so that's all going to be covered, so that's good. Do you have any psychological problems, any mental health history or anything like that? Okay. Okay, some anxiety. Okay. And what do you do for that? Do you take anything for that right now? Okay, you're on some anti-anxiety medications. How is that working? Good, but you like to get, I understand. Okay, well, we can set you up with a therapist to talk about that, and also I can help you and give you some pointers for natural ways to help your anxiety. However, sometimes we do need medication, and that's nothing to be worried about. Okay, but it does give you some dry mouth. Yeah. I'm going to go ahead and write that down. Okay. What about seizures? Okay. Do you have any sleeping problems? Do you have any problems going to sleep or staying asleep? No. Okay, wow, that's great. You're rare. All right, stroke. No stroke. What about seizures? Thyroid disease? All right, and this is just for COVID purposes, but have you been experiencing any flu-like symptoms in the last 72 hours? No. Have you traveled out of the country? Okay. Oh, you have? Okay. You went to Mongolia to practice falconry. Okay. Well, falcons actually do have a high risk for COVID, so we're going to go ahead and administer a quick COVID test, okay, to make sure you didn't interact with the falcon in any inappropriate way or just by accident have the air particles from the falcon's beak fly over to your head or nose. And we're going to check you up for that, okay? And you're probably going to be fine, but I'm definitely not going to, I'm going to bow out until we get those results back because I have kids and I don't want to give them falcon COVID. So let's get this a minute, okay? Okay, and your test came back and it came back negative, so that's good. You do not have COVID. All right, great. So next, let's talk about any medications you're on right now besides the anti-anxiety. Okay? No? Okay. What about any vitamins? Do you take any vitamins? Just a multi? That's usually covering everything. But can I ask you a few questions about your diet? Okay. All right. So what is your diet like? Do you have a lot of proteins, do you lean into any type of food group? How are your macros? Okay, you just eat whatever you want. That's great. That's usually what we advise to do in this clinic, is to just eat whatever you want. However, when you start to experience health problems due to diet, we can start to go from there. But we usually don't like to give people food anxieties and tell them that you have to be on this diet or that diet. Different diets work for different people, so I'm glad that you have approached a very holistic, open approach to eating. All right, so any allergies I should be aware of? Okay, good. All right. Are you allergic to dogs at all? Okay, that's good. All right. Because I have a Tibetan Mastiff in the back, just my personal dog that I like to bring to work. So I like to make sure that patients don't have any allergies to animals, especially to large dogs. Okay, that's good. All right. So it looks like this form is almost complete. I'm going to need a quick signature on this form from you, okay? And then we can go ahead and proceed with your head to toe examination, all right? No reason to worry, okay? This is going to be completely fine. A lot of people have doctor anxieties. Do you have any doctor anxieties? Because you did mention that your blood pressure tends to rise whenever you're at the doctor. Okay. Okay, why? Are you afraid of me? Okay. All right. Well, there's no reason to be afraid. I'm here to help you. And I just really want you to relax and maybe even take a few deep breaths and enjoy this. So first, I'm going to take your temperature. If you could give me your forehead here for a quick second. Okay. It is 98.9. That is a very good temperature, so you're good with that. Now I'm going to take your blood pressure, if that's okay. I want you to hold out your hand. Okay. Just going to fit this around your wrist. And just take a few deep breaths for me. Good job. Okay, good job. Very good. So it is a little elevated, but I can tell that that's because you have some anxieties about going to the doctor, because it's not that elevated. So that's good. You don't have to worry. But we're going to take it again in maybe 10 minutes just to make sure, all right? Okay, if you could hold out your wrist for me. I'm going to take your pulse with my fingers right here. Okay, then just breathe in, breathe out. Okay. Okay. So it's 64 beats per minute. That's very normal and equal. Great so far. Okay, and since you have some anxiety issues surrounding the doctor, I just want to put in an extra effort and make sure that you're feeling good. So I have this cinnamon leaf aromatherapy, and that's going to wake up your senses while keeping you relaxed. Okay, do you like cinnamon? Oh, you're allergic to cinnamon. Okay, let me get another one real quick. Sorry about that. You didn't tell me you had allergies before I asked you that question. Okay. All right. I'm gonna write that down that you're allergic to cinnamon, and then just from now on, just really be upfront with me. That's gonna be the best scenario for this, because we really don't want to overlook anything. Especially, I was about to put cinnamon in your face. That would not have been good. Okay, so I'll be right back and I'll get another one for you. Okay. Okay. How are you with lemon? It's good? Okay, great. So I'm going to take this, and I'm just going to first, this is heavenly. Okay, I want you to face me, and I'm just going to put this, massage it on your head. Okay, really get in the back of your scalp. Yeah. You don't have to do anything, just relax, okay? Okay, feeling in the back of your head. And do you smell the lemon? It's divine, isn't it? Great. All right, now I'm gonna apply some pressure, okay? Because I don't think we got enough lemon in there, and I really want to make sure that it gets into you. So just relax, and I'm just gonna press the front of your face really hard, okay? And in doing that, the lemon is just gonna jump from my fingers and get into your pores and make love, with that lemon. You're gonna be getting a lot of lemon love, okay? Lemon heals so much. Can't even tell you, so just now you're awake. Now you're awake and you trust me a little more, because I haven't hurt you yet. I've only given you enjoyable experiences. Hopefully that will continue. And now I'm going to listen to your heart and your lungs, okay? I'm just kidding. I'll use a real stethoscope, all right? So now I'm going to give a listen to your heart and your lungs, okay? So, I want you to go ahead and breathe for me, okay? Okay. Okay. Beautiful. Beautiful. Good, your heart is making some beautiful sounds there. I can tell you have a very good heart, and it's beating properly, not too fast, not too slow. So whatever diet you're on and whatever medication you're taking, it seems to be really helping in terms of heart health, which is probably the most important health that we can have. So that's really good. That's amazing. So now I want you just to turn around. Yes, so I can listen to your lungs. I like to listen to my patient's lungs via the back. Okay, so I'm going to press this cold. It's going to feel a little cold. All right, right against your back. And you're just going to breathe in for me. Take a deep breath. Good, and breathe out. Great. Great, okay. Do it again. Okay, and breathe out. Lovely. All right, so that sounds all normal. And so your heart and your lungs are probably a couple of the most important organs that you have, and they're doing super well, especially for your age group. So that's fantastic, Lester. Okay, so now I'm going to test your eyes. All right, so I want you to look at this tip of this pen, okay? I want you to follow it just with your eyes, not with your head. So keep your head straight. I just want you to move your eyes to follow the pen, all right? Good. Good. Okay. Good. Good. Okay. Did you read that? Okay, well, you followed that really well, all right? So that's good. Now I want you to let me know when this tip of this pen leaves your field of vision, and only look at the tip of the pen, not my finger. So let me know when the pen leaves your field of vision. Good. 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 That's great. I'm going to go ahead and write down that your field of vision is really good. Okay, now I'm going to test that you know how many fingers I'm holding up. How many? 3, good. 2, good. 1, good. 0, good. 3, good. 10, very good. Okay. 1.5, that's excellent. Okay. Okay, great. So that all went really well. Okay, so now we're going to do a color test. I have the tips of some mighty interesting looking pens. So I want you to tell me the color of each tip, okay? Yellow, good. Green, good. What shade of green? Forest green, very good. Pink. Gray, that's great. Purple. And trick question, that's a yellow again. So you know all your colors, so I don't see any signs of color blindness, which is common for your demographics, so you're doing really well in that regard. So I'm not a dentist, but I do have some interest in the dental field, and it's kind of like my hobby. I like to look at people's teeth and dabble in dentistry. It's like pilots, people who fly commercial planes, who fly helicopters and little planes on the weekends. Well, I like to, mess with people's teeth on the weekends. Not mess with them, but, give them a good what for. And really look into their teeth and mouth. It's a fascinating thing for me. So I'm just going to ask permission. Will you allow me to take a look at your mouth? Okay, good. Open your mouth. Good. Can I see your tongue? Good, 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 good. I just want to check your teeth and just make sure that, things are, that your teeth are strong, that they're not falling off. None of these teeth are falling off so far. That's incredible. Okay, I don't see any cavities. I don't see any signs of gingivitis or plaque, which is amazing. Okay. Alright, so now I'm going to take this little DNA scraper and scrape some DNA off of your teeth. It's important to do that, especially right now in these trying times, because there is someone that's been dressing up as a jester and going to the grocery store and stealing all of the paper bags and forcing people to use plastic. So that's the current crime spree that's been going on, and a lot of the environmentalists have been raising concerns about that. Plus, it's illegal to steal. I just want to make sure that you're not that person, And so I'm just gonna scrape a little DNA off your teeth, and we're gonna run it through a lab and see if it's a match, okay? You're probably not the paper bag bandit, but you know, we always have to be sure. And when you walk into a doctor's office, you have to brace yourself that you might be interrogated for a crime. Okay, I'm also an interrogator and a detective. Okay, so I'm just gonna scrape your teeth a little bit here. Okay, great. I got a little, wow. Okay, so I'm just gonna run this through a quick DNA test. Oh, okay. Okay. It took a while to run. For a minute there, it said that you were a perfect match. But when the test completely processed, it ruled you out as a suspect. So, you gave me a little heart palpitation myself. So, all right. Well, that's good to know. I like to know a lot about my patients. So, it's good to know that you're not on a crime spree or anything like that. So, all right. That's really good. Okay. So, why don't you just let me see the bottom of your tongue? So if you could just move it up like that. Okay, I'm just checking to see that everything underneath your tongue is good and no signs of fungus or problems. Could you move your tongue side to side for me? Good, side to side. What is that for? Oh, I don't know. I just like to see people do it. I think it's funny. Yeah. Okay. Good. Well, you did that very well, and I was thoroughly amused. So that's really good. Now I just want to quick check your reflexes. So if you could just sit up on that bench right there, that'd be great. And I'm going to take this hammer and just hit it against your knees, okay? All right, don't think too hard about this. Good. Good, those are good reflexes. That's great. So can I have you take off your shoes so I can just take a look at your toes and your feet real quick? Okay. Okay, I see that you have some foot halitosis going on. So what I'm going to do is prescribe some foot odor repellent for you, and this is just a powder. It's a medical grade powder, so it's going to be stronger than what you can find in a drugstore. And what you do is you just put it in your shoes and then rub the rest on your feet every night before you go to sleep, and that should really help a lot of that foot odor. And then that'll help your quality of life, I'm sure, if you go on dates or just go out and hang out and things like that. People want to be around good smelling people, okay? All right, you already wear a cologne? Excellent. Don't wear too much of it though, you know, there's nothing worse than someone that wears too much cologne. That's not a medical assessment. That's just a personal one, so feel free to disregard and wear as much cologne as you'd like. Okay, great. So your feet look normal, I see. Okay, good. Do you have any history of bunions, or do you have any warts or plantar warts? No, none of that. That's really good. So all I see right now, I'm going to take a look over your chart real quick. But you seem to be in fantastic shape. All I'm seeing right now is a little foot odor. Foot odor. Okay. And so we're going to set you up with something like that. I'm also going to set you up with someone to talk to about your anxiety and set up an appointment with that. You'll just go to the front desk. Her name is Dr. Katie. Okay, and you'll be seeing her next week. That's all right? Okay. All right. No, I'm Dr. Katie, but she's a different Dr. Katie. Yeah, she looks a lot like me, but she wears a little hat. Yeah, you'll see her right when you leave the clinic. Okay. So everything looks super great. I'm so glad to establish care with you. Can I ask what led you to leave your old doctor? Oh. Wow. This is the first time you've seen a doctor in many years. Wow. Okay, the last one you saw was in Pennsylvania. Okay. Okay. Well, I am so happy that you chose me, and I'm also super thrilled to see someone that doesn't see a doctor regularly and that you're so healthy. So I think you should be proud of yourself for that. And you know what? I think Dr. Katie's going to see you next week, and you're going to just do great here and thrive under this clinic, okay? So thank you so much for coming in, and I really want you to continue to relax, get some great sleep, and have a great weekend.